Hi, good afternoon. My name is Candice Belanger. I manage the street outreach, harm reduction, and sexual health programs at the Thunder Bay District Health Unit. I am a nurse by training, and I did spend a lot of years of my career in frontline work. Before I was a manager of these programs, I worked mostly in mental health and addiction. So I spent some time working in the corrections system as a nurse. I also spent some time in mental health nursing, in community and home care. And but the majority of my career has been in public health, working in both the street outreach and sexual health programs. And the idea behind these specific programs, the street outreach program, is to bring public health services such as testing for bloodborne infections or infectious diseases and immunizations to people who can't access our traditional office. So maybe people who are homeless or underhoused, or who may be using substances where it's difficult for them to make or keep appointments. And so this team goes out and meets people where they're at, and often serves people who are using substances. And we have a harm reduction approach. So meaning that we are not going to judge people for using substances. We're going to provide them service that's going to help keep them as safe as possible, even if they're using, and promote as much health as possible for them. Well, it's not sort of a one size fits all, but we certainly have very high rates of opioid toxicity, and opioid poisonings, so meaning overdoses and potentially deaths related to overdose in Thunder Bay and District. We have nearly the highest rates in all of Ontario, sometimes the highest rates, sometimes depending on when the statistics are collected. So it means that people who are dying from opioids or toxic drugs, and so that can have an impact on people in a lot of different ways, or organizations even in a lot of different ways, who are doing the work of maybe trying to do harm reduction. So we are losing clients regularly. We are trying to serve a big population as well. So there's also a lot of stigma around drug use or substance use. So people being judged, for their substance use, and that can impact on them being able to access care. And so that care can be for different things. So just overall wellness, perhaps even it can impact on them accessing care to address their addiction or substance use. So I think stigma is one of the biggest barriers and impacts on folks. I think also one of the other impacts that can come with substance use is that there can be real challenges in housing and finding places to live. And so we've seen a significant increase in homelessness over the last few years. I think some of this is probably related to pandemic, post-pandemic issues and inflation, but also when individuals are using substances, sometimes it's harder for them to do the things that they need to do to keep their housing. And so that's something that we've seen a big increase in. And so sometimes you'll see encampments or people living what they call living rough or living outdoors. Substances can put people at risk for other things, other health concerns. So depending on how they might be using those substances, there can be risks of transmission of things like HIV, hepatitis C, and we do have higher rates of some of those infections locally. So we do see some of that impact. And so it's really important, again, to try to decrease the stigma for people to access care and testing, even if they're using substances so that we can try to reduce the spread of infections and get people engaged in care so that they can be the healthiest that they can be. I just really think if I can emphasize anything, it really is around decreasing the stigma of substance use and making it like approaching people with kindness and respect. And just what we kind of talked about, not know, like everybody has a story and we don't always know all of the pieces of that story and why they are where they are. But all people deserve respect and care and a chance at wellness. And that can look very different. Like substance use can happen on a continuum. And some people can use substances and be very healthy in their lives, and some people can use substances and it's really impactful on their day-to-day life. And so yeah, just helping everybody get to a point that they can be the healthiest that they can be.